So I came to John for mainly physical issues, but he had sent me some information about psychological issues, and to me, I believe that was actually the trigger to a lot of my physical symptoms as well as other things that happened. But I've struggled with lifelong extreme trauma, lots of abuse, and divorced parents, and so I developed severe dissociative disorder. And as a kid, around the age of 4, my parents had divorced, and around that time, I really, those dissociative issues really became strong. It was a 5-year custody battle, and I was going back and forth between people. I had memory lapses, I had disconnect from my body, a majority of it. And as I aged, around the age of 11 or 12, I was told that I completely lost all emotion. And around the age of 15, I developed severe panic attacks, to the point it was just debilitating. I couldn't get in the car, I couldn't go into the house. I was afraid of a lot of things. And around that time as well, because of the trauma, I developed anxiety, depression. I had flashbacks, noise sensitivity, there was sound sensitivity, difficulty sleeping my entire life. And that's a majority of my psychological issues. So some of my physical stuff that I struggle with is postural orthostatic tachycardia, chronic fatigue syndrome, and I learned later on that I developed mold toxicity, which I believe to be the symptoms of many of those issues. And that really debilitated me and made the noise sensitivity even stronger. Also, as a kid, I had undiagnosed ADHD, which really affected my life. I was in a classroom, I was in a separate classroom, I was combative with parents, with authority, and that was really bad. And I was undiagnosed with dyslexia and dysgraphia, which really affected my education. So I learned about Len's neurofeedback through a friend who also struggled with chronic fatigue and mold toxicity. And she told me about it and the benefits and how quickly that she recovered in a very short period of time, along with a different type of therapy. And that's when I actually began seeking out treatment, and I looked up John. And the important thing that I really wanted to know is how well trained that they are. And I spoke to John, and he was very knowledgeable and gave me lots of information. Being a nurse, I wanted to know how long someone's been practicing and gauge the information that they know about something. And that was one of the concerns that I had, is for one, I didn't really know about lens therapy. And initially hearing about it, I was thinking maybe it was going to affect my brain, it was going to make my symptoms worse. Other modalities that I've tried in the past is talk therapy, art therapy, dance therapy, cognitive behavioral therapy, dialectical behavioral therapy, anger work, animal therapy, dance, art, yeah, and many, many more. And medications I've tried is the gamut. I've been on medications ever since I was a child: antidepressants, atypical antipsychotics, anxiety, depression medications, SSRIs, SNRIs, many medications. So in my first lens session, I got here, and I had a lot of concerns initially, but he was very welcoming, very friendly, and he gave me questionnaires, and I filled out a background. We discussed my questionnaires and any of the questions that I had, and then any other concerns that I had prior to starting the treatment. My first lens session was absolutely incredible. I could feel my brain change, and I felt like an incredible high. Every time when he changed the leads on different parts of my body, I felt just an incredible endorphin high. And I could actually feel the different places in my brain that would change, and I would tell him that it would like start here and go down, and it would go down like into my chest, and I felt an incredible cooling effect, something I've never experienced in my life. And it was just this wave of just calm completely on my body. I could feel an improvement in my first session, and I could feel my whole nervous system had shifted. And what I would tell John is I feel like my system's either on or off. It's either fight, or freeze, and fight, flight, or freeze. And so it would flip-flop back and forth. But when I was in session, I felt it like kind of get centered. My body was actually functioning. One of the main things that really changed for me was my energy level, which I had always felt that disconnect that I spoke about. And as I progressed through treatment, I finally felt my energy coming back, and my nervous system no longer flip-flopping. It was kind of centering in my body, and I finally had energy. And I would say I'm probably about 50 to 60% right now. So now that I've been seeing John at NeuroBalance, I feel like my symptoms have really changed. I feel like there's now like a buffer between me and my issues or my trauma or my past. The flashbacks that used to envelop me, I no longer struggle with that so bad, unless it's a really bad trauma or flashback, but there's like a distance, and I can see it in the distance and say, hey, there's like, I have this issue, or this is gonna bother me, and there's this distance between it, and I feel emotionally, I don't feel it. It doesn't envelop me and control my life. So the POTS and the chronic fatigue, those things have really improved. I'm not necessarily as tired. The POTS, I'm not necessarily getting tachycardia nearly as bad. And the biggest thing that I really remember is that flip-flopping, that I had one session that was extremely powerful, and I literally felt like I could run. And that's a big change for me. In addition, you know, when I first came to John, I also struggled with suicidality and frequent hospitalizations as a result. And that has also gone down significantly. And also the ADHD symptoms and the learning disabilities. In regards to the ADHD, I no longer am so frazzled, and I go from thing to thing or whatever I'm doing, and I now have more focus, and like I said before, there's that distance, so I can see exactly what I need to do and tackle it in a different way. I'm in a much better place now that I've been working with John at NeuroBalance, and I just feel a lot more stable and a lot more consistent. My brain functions better. I have more energy. I'm not as reactive. And so if you're considering seeing John, I would not hesitate. And if you have any questions or concerns, just call him. Just talk to him, because I guarantee he'll know the answer to it, and just have a conversation.